सुरुमा पछाडिबाट rhomboid लाटी गर्नुपर्छ.
To conduct this test, have your patient in prone lying position with the test hand at the height of the opposite back pocket. Then palpate the medial border of the scapula with your index finger and ask your patient to push his shoulder forward against slight resistance. Then ask your patient to lift off his hand and forearm away from the body. Okay. If the rhomboids are normal, the index finger is pushed away like in this example. Otherwise, we are talking about a positive test. All right, this was our video on...
For the teres major, the patient is positioned in a prone position on the mat. The limb is placed in a position of shoulder extension and internal rotation with the hand placed pretty much right over the posterior superior iliac crest, just like that. The palm is facing posterior or toward the ceiling. Stabilization is provided by the mat. Also, you may stabilize the opposite shoulder. Resistance is applied to the distal humerus, and it is applied in a lateral and anterior direction into abduction and flexion. So pretty much just like this. Hold that. Don't let me move you. Hold, 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 hold. Good. All right. This muscle, teres major, is palpated right here at the posterior border of the axilla.
The patient position used for all tests is to have the patient prone with their head turned towards the test side. The test movement will be shoulder extension and adduction. The test for grades 5 and 4, the clinician will be providing a force into shoulder abduction and slight flexion. If the patient's able to hold against maximal resistance, they earn a grade of 5. If they can hold against strong to moderate resistance, they earn a grade of 4.
Hold your arm up. Don't line into it. Relax.
To test for grade 3, the patient is asked to complete the test motion while the clinician observes the amount of range of motion. If the patient is able to complete full available active range of motion without resistance, they earn a grade of 3.
Lift the palm towards the ceiling. Relax.
For grades below 3, the clinician will be observing the amount of range of motion while palpating the latissimus dorsi muscle. The patient attempts to complete the test motion. If they're able to complete partial range of motion, they're scored as a grade 2. If no motion is detected, however, there is contractile activity, the patient is given a grade of 1.
Teres minor. So this is called the hornblower's test. And what you do is you take your patient up into the pitcher's position, just like this. You have them hold that there. Now, this is a difficult position to get into if you have a rotator cuff irritation of any sort, a tear or tendonitis, but you try to have them hold that position. And then I always use just a couple fingers and I have them try to resist external rotation like this. If they have a tear of their external rotators, more specifically a teres minor, that arm will give down like this. And sometimes they will hike here as the arm gives in. So that would be a positive.
Since it lacks strong ligaments. Function is external rotation of the upper arm and can be examined through the infraspinatus test. Start by demonstrating the motion. External rotation with the elbow flexed at 90 degrees. If the patient is able to repeat this motion without problems, it should be performed once again, but this time against resistance applied by the examiner. In this position, external rotation always involves the deltoid muscle as well, especially its posterior head. To minimize its influence on the motion, external rotation against resistance can also be performed with the arm abducted at around 90 degrees. The infraspinatus test is positive if mobility is limited or if it elicits pain. This can occur in, for example, a rupture of the muscle or its tendon, or in atrophy following damage to the suprascapular nerve.